On to the latest in the cholera outbreak. It was reported in Budiriro last week and has left neighboring suburbs in Harare in panic. Budiriro, which now has 4 of Harare's 21 confirmed cases, was the epicenter of the past outbreaks. The densely populated area with poor sanitation means the outbreak has taken another turn. To get the real picture, Mirain Singo compiled the following report.
48-year-old Audric Nduna in Glenview is fearing for the worst. The cholera outbreak in neighboring Budiriro could soon affect them. This will not be the first time to experience such an outbreak. In 2008, the area was hard hit by an outbreak that left thousands dead. Uncollected garbage and unsafe water means they are still at risk.
Patiri pano marara aya akutofamba kusvika kwese kwakamera vakomana vari kumotikari idzo dziripo idzo sekutenderera kudai kusvika uku wilovho inotombopotsa mukatotarisa kunze uku.
Residents like Audric rely on water from unprotected wells and boreholes. Sadly, some of the boreholes in the area are also contaminated. Zimbabwe as a whole is fighting a cholera outbreak. The outbreak has been reported around the country, and residents blame the local authorities for poor service delivery.
We are aware that service delivery has declined, has deteriorated in the last few months, but the actions of the local authorities leaves a lot to be desired. There is not much agency in their interventions.
Health experts insist in the absence of proper water and sanitation, the challenge will persist.
There are discussions, ongoing discussions, and assessments that the Ministry of Health and Childcare is undertaking, which will lead to generating the evidence to inform decisions on whether to use the cholera vaccine or not.
Harare City Health Department says there is need for an improved service delivery to fight such diseases.
We are making efforts for us to improve or to achieve our targets. Obviously, the issue to do with water supply is to improve.
The situation has reached a point where the country is considering a cholera vaccine.
This current outbreak, there is need to conduct a rapid assessment before vaccines can be rolled out. But I must say the process of getting the vaccines and rolling them out to the community has started.
The situation is dire, and just like during COVID-19, the private sector and all stakeholders must come on board and play a part. And now we cross over to our expert, Dr. Amos Marume, to find out more on risk and methods likely to work in the face of the outbreak. It's good to have you on tonight's edition of News Plus Stock. Now, the issue of vaccination is being talked about, and it is likely to target hotspots. Will such a method work in trying to contain the situation?
Vaccines do work. And it's something that our community should welcome, especially in those hotspots where they are going to be administered or are being administered. It's a welcome development, depending on the type of the vaccine. But in most cases, most of these vaccines are 80% or so effective. And the effectiveness starts to maybe day 10 after vaccination. You can start to expect that form of protection. Some retain up to 3 months or so. Again, depending on the type of vaccine, some would require more than one dose. Again, it depends on which version is available. But for cholera vaccination, do help. But it needs to be accompanied by other interventions like, the traditional ones where, the health education and promotion, the need for maintaining hygiene and sanitation, washing of hands, access to clean water, and also availability of treatment options, effective antibiotics, and also oral rehydration salts. As a concoction, it definitely would work and prevent death and suffering. But the worry that can also be raised is the one that since we are coming from COVID vaccination created a lot of negative perceptions around vaccines. So it will be good as an intervention to also add a little bit of education to our healthcare consumers that vaccines are safe, effective, and are a necessary tool of public health interventions in terms of preventing and or managing diseases. So there might be that need to again invest in ensuring that people don't just resist vaccines.
All right, Doctor, now you're saying vaccines will definitely work, but let's take a look at our education system. Schools will be opening in a few days from now, and with that comes a mixing and mingling of the younger ones. What measures could be taken first to protect the children, and secondly, to avoid making schools the super spreaders?
Coming from COVID, we definitely have to open schools. We can't close schools. But the Ministry of Health can borrow, from what strategies that were used when we were coming out of those COVID lockdowns, such that it can, produce maybe a minimum guideline to say every school should have, these, things like access to clean water, hand washing, and sanitizing, sanitation or sanitizing centers or pots, and all those. And maybe it also is good to ensure that even from the school, oral rehydration salts are there, and maybe establish those hotlines again. All that would help, and ensure that our children are safe on top of the vaccination and the other interventions that are being done in the nationwide.
Well, thank you very much, Doctor, for coming through to share your insights on how to curb the cholera outbreak. That was Dr. Amos Marume, who is the principal at the Harare Institute of Public Health.